thanks everyone for coming. I'd also like to acknowledge that we're on Aboriginal and Torres Strait Islander land, wherever we are in Australia, and welcome anyone from around the world too. So I presume that maybe one or two of you from the world scene, and it'd be great to hear from you later. So what we're going to do, Chris, Hartley and myself, are just going to run through a presentation which is about the homelessness side of things from COVID-19. That's the impact of COVID-19 on homelessness, and also what we're seeing in terms of policy responses. We do have a CSI response document that you can get from the web, which we wrote early on. We got that to version 2 as well. And that provided an overview of how we see the impact of COVID-19 on homelessness and what we all should be doing to ensure the least possible impact of COVID-19 on homelessness. But maybe beyond that, to use this as a great opportunity. So welcome everyone. And I assume that what you're seeing right now is a screen that has a PowerPoint on. I presume also that everyone here in this virtual room knows more about Zoom than I do. So if I slightly mess up, don't worry, we'll just keep on going. So one of the things that is really interesting about COVID-19 and homelessness was how quickly the homelessness sector worked with government, worked with healthcare workers around the public health response to COVID-19. This was quite incredible. And it'd be interesting to hear your views about that and any stories you have about how quickly we believe that governments and homelessness services and healthcare workers really got behind the public health response. What we know is that COVID-19 has a greater impact on those with health conditions already. And all of our research and the research from many and the lived experience is all saying that there is a significant group of those experiencing homelessness, particularly those with chronic rough sleeping, with long-term health conditions. So what was really important was that we had to get the public health message out to homelessness services, and that was done in the main. And that was done both in the context of support accommodation, rules around how we should work, hygiene, etc. But it was also done in terms of a particular response in the rough sleeping area, as well as those in other forms of homelessness. So the first thing I want to talk about is just how strong that response was. As a rapid response to the issue of rough sleeping in particular. Now, we don't have the numbers just yet, and I'll probably be looking at that very soon, but we estimate that potentially up to 2,000 or so, or perhaps even more rough sleepers around Australia. But more than that, in terms of all of those experiencing homelessness, have been provided with transitional accommodation, many in motels and hotels. That's, in my view, the largest movement from the streets, if you like, to accommodation that we've ever seen. The process hasn't always been smooth in every place, and in some areas, and this will be a discussion point, I know, for everyone, government support has been limited, but in general terms, it's been a pretty amazing outcome. So right across Australia, whether you're in Melbourne and you see what Launch Housing or Sacred Heart Mission are doing, Salvation Army, up in Brisbane, it might be Micah Projects, and Nimai, Rua, and United Care West in Western Australia. This has been an amazing kind of response. And one of the things that was so amazing about it was that the platform for that had been developed in terms of assertive outreach, those early street to home programs, the street counts, registry weeks, the Advanced to Zero program. The by name list in particular was so critical in particular areas. So, for example, in Adelaide, just how strongly it was used and in Brisbane to ensure that we knew the people who were there, we knew their needs, and then we were able to move people on, or rather services were. I did nothing, but people were able to be moved into motels, hotels, not always staying, but it's been pretty significant. Now, what we want to do is use this platform, obviously, to be able to move to permanent housing. Permanent housing is the big thing. It's not about this temporary accommodation, but this is providing a potential platform, particularly with the housing market at the present time, for an amazing response going forward. Housing first kind of response to a really significant reduction in rough sleeping in particular. So that's the first thing. The second thing, of course, is we know that COVID-19 is going to have is having right now a very significant economic impact. Loss of income, economic contraction, unemployment. We've got the job seeker and job keeper measures in place, but that's not actually covering everyone. There's been a lot of confusion around JobKeeper, for example. So the stimulus and income support measures have been very significant and have reduced the potential flow into homelessness beyond that which would have been expected. But what we're seeing, and it'll be great to get that response from people later, what we're seeing is that the first signs of those moving into homelessness who might fall through the cracks, who may actually not be sustaining their housing, and Chris is going to talk about the eviction issue. We're starting to see this, and so we really need to be very careful about that, if you like, new wave of homelessness coming through. Beyond that, though, there are other issues that we've got to be concerned about with the homelessness issue and outcomes and COVID-19. So as a necessary public health response, social distancing, isolation, etc., has come in. And what we know from particularly the women's refuges and the family domestic violence area is a concern about a rise in violence. There is a related impact in terms of youth homelessness, because all of our research over the last 15 years has said one important thing, that when you're looking at those who are in teenage years, in adult years, around about half had their first experience of homelessness as young people below the age of 18. And that experience is so strongly related to family domestic violence, where kids are thrown out of home in that violent kind of situation, or they run away from home to get away from it. There are other reasons why they run away from home as well. And this is going to be a big issue. So youth services deal with this, and with schools in the past, and I know the school issue is very big, schools were a very strong place for young people in their teenage years if they're experiencing homelessness, and they might be couch surfing and the like. And we are so concerned about that issue. Then there are those questions about support. So yeah, I mean, if you've got good mobile phones, if you've got good internet access, and you know what actually the word telehealth actually means, it's great. But many people have missed out on services where there's been a closing down of face-to-face delivery. And that's been a big issue that we've been picking up. And we're certainly doing some research around that. And another big issue is when there is that transformation into housing, either in terms of temporary housing or in terms of permanent housing, there hasn't necessarily, in all places around Australia, been an adequate response around culturally safe and appropriate housing supports for Indigenous people. And the rate of homelessness among Indigenous people is far greater than the general population. And so that's been a concern as well. So What we're seeing is an incredible response around rough sleeping, which we want to build on in that platform of ending homelessness in Australia. But concerns. Now, what I'm going to do is throw over to Chris, who's going to quickly run through some housing issues. And that is not just about the question of stopping the flow from those in rental accommodation in particular, but also in owner-occupied if people can't make their mortgages, and the eviction question, stopping that flow, as well as our longer term vision of ending homelessness, which requires housing. So over to you, Chris.
Thanks, Paul. For those who don't know me, my name's Chris Hartley, and I'm a research fellow in housing and homelessness with the Centre for Social Impact in UNSW. And as Paul said, I'm really going to focus quickly on two key issues. So one is how we went about keeping housing people who are housed, particularly those suffering severe financial difficulties, and also the broader implications of now that we have these housing that's set up, as Paul was saying, that it's incredibly important that we take up the opportunity that COVID has brought in terms of the homelessness space, and how do we get people into permanent long-term housing and really fix the structural housing issues that were in place long before COVID. So in terms of our ask, so as Paul mentioned, that we put together just at the very beginning of COVID, a response that we thought governments across Australia should implement in the policy and program responses in response to COVID. In the housing space, there was two main, which you can see up on the PowerPoint. So was to introduce a government-imposed moratorium on evictions and to increase the supply of permanent housing for those experiencing homelessness. And so what did we get? Next slide, please, Paul. A very lovely picture of Scott Morrison there. What we got was National Cabinet on the 29th of March giving a commitment that there would be a set of principles provided to each state and territory for them to develop their own set of criteria around evictions. In the interest of time, I won't go through each state and territory which has implemented a system. So I should say Northern Territory hasn't implemented a system, but there's a link there which will be available after the webinar right next to Scott Morrison, which provides a really good overview of the systems in place in each jurisdiction. Next slide. But what I really quickly wanted to focus on, given one, it's my home state, but also I think that it gives a good illustration of both the benefits and good things that have come out of the moratorium, but also some of the gaps in the system. So on the 13th of April, the New South Wales government announced their scheme, which came in operation on the 15th of April. It's details of the moratorium and evictions. So the scheme really has two steps. So one is an interim 60-day stop on all evictions for rental arrears, where the rental housing has been financially impacted, and that's quite important, by COVID-19. This stop commences 15th of April and is in place for 60 days. After the 60-day stop, restrictions on evictions for rental arrears for COVID-19 will apply for 6 months. And under this step 2, a landlord will only be able to apply for eviction if on the basis of rental arrears, if they can show an attempt to negotiate rent reduction with a tenant has occurred in good faith, if an informal negotiation has failed, that there's been a mediated process between the tenant and the landlord through the Department of Fair Trading, and that the eviction is fair and reasonable in the circumstances of that specific case. Again, in the interest of time, I won't go into the specific criteria that you need to show in order to be eligible as having been financially impacted by COVID-19. But again, it's really important to know that you must actually demonstrate that you have been financially impacted. And also that the New South Wales government also increased notice for some no grounds termination, and also provided 90 days notice periods for boarding houses as well. Next slide. Thanks. So what does the New South Wales scheme illustrate for us? Firstly, even though the slide is kind of titled What's Missing, we should acknowledge, as Paul has before, that the efforts of most states and territories have been quite significant, and it's quite a significant shift forward from what has actually occurred in the past. But in saying that, there's some severe limitations, both with the New South Wales system and other states in general. And I think given the nature of governance of private rental is a state-by-state jurisdiction, it probably had to go this way. But given that there's different schemes operating in different states, it's created a whole lot of confusion, both for landlords and for tenants. As I said, it's particularly disappointing that the Northern Territory hasn't implemented a response yet, with an area that has rates of homelessness, I think, are 12 times higher than the national average. It's a particular concern. It's also important to highlight that the moratorium on evictions is actually misnamed, that it's not a complete moratorium on evictions. It's in most states and territories, with the exception of Tasmania, it's actually a moratorium on evictions on the basis of rental arrears or financial difficulties. So evictions can occur and have been occurring in the situation under COVID-19, which from our end is a little bit disappointing, because from a public health point of view, that really the intention of stopping evictions is to restrict the impact and effect and spread of COVID-19, which is difficult to do when someone's being evicted either into homelessness or they're required to search for additional properties. On that point, it's clear, I think, from discussions that we've been having with tenancy services across New South Wales and across Australia, that evictions haven't stopped at all, that there's been a significant increase. I was speaking to one tenancy service yesterday where they were estimating about 6 times the amount of ordinary calls that they're getting in terms of evictions are occurring, and this was in New South Wales, where there's supposedly a break or a moratorium in place. Next slide. I should also say that one big issue around this is particularly around the no grounds issue. Most states and territories around Australia have a no grounds termination, which really allows a tenancy to end by a landlord with very limited notice and without a ground. Most jurisdictions haven't touched those no grounds, so it's a big concern, and I think it's actually operating at the moment that we're seeing landlords in particular getting around the rental arrears moratorium, or the requirement to enter into good faith negotiations around rental decreases by trying to do an eviction through no grounds. So what can be done? In putting these together, I was trying to think of some practical solutions that are in place. Sorry, Paul, the slide back. That we as advocates, or we as kind of people that are very passionate and care about this issue, can be involved in. So one is a campaign which I'm involved in. It's being organised and coordinated by tenant services throughout Australia. They're really looking at each jurisdiction to look at, as a whole, what are the principles that should be in place which aren't at the moment. And you can see on the screen a couple of criteria that they're looking at in terms of what an adequate response in terms of evictions would be. Next slide. I also wanted to briefly touch on the issue of keeping people housed. As I said, it's been a remarkable thing to actually see that the once will is actually there, that people can be housed. But it's important to remember that the housing crisis existed well beyond COVID and will exist perhaps in an exacerbated form once COVID ends. When we were talking about before COVID, the housing system was in a space of crisis across the housing continuum. We had considerable waiting lists. I think it was up to 150,000 for public housing. We had waits for up to 10 years for public housing. And researchers indicated that there's a national shortage of just over around 400,000 homes that are needed for those who are homeless or living on the lowest incomes. And next slide. Again, another campaign which has been really important to support at this time is Everybody's Home campaign, which is a national campaign which is advocating for a fairer and more balanced housing approach. One of the key asks that Everybody's Home is calling for at the moment is for the Australian government to invest in social and affordable housing. and for that to be a key safety net for Australian renters, but also to provide the construction impetus and jobs and apprenticeship that Australia really needs to rebuild post-COVID. That campaign is getting some traction, and was also really grateful to see that ACOS came out recently in its post-COVID-19 economic recovery document, which we can provide a link to in the webinars as well, which, as part of its measures, one of the measures it called for a $7 billion public investment to construct 30,000 social housing dwellings. Significantly, they estimate that if for every $1 spent is estimated to boost GDP by $1.30. So it's an incredibly important scheme, and we hope governments will kind of take that on board. Next slide. Finish my bit with what I think is an awesome quote to sum up the situation that we're kind of in at the moment. For me, we can't go back to what was in place before COVID, and the pandemic has really exposed, for me, ideology. It has previously been disguised as necessity. There's been constant talk that we couldn't house homeless people, that we couldn't increase New Start. There was a whole range of measures that couldn't happen. We can see when will is there that it can actually occur. But also that COVID-19 has really exposed and brought another layer of vulnerability for groups such as those experiencing homelessness. But homelessness without COVID-19 is still a crisis situation, and it's something that we as a society really need to hold on to. And as homelessness is a crisis, we must ensure that people are not exposed to homelessness, be it either through evictions or through a lack of appropriate housing. And particularly as the Morrison government has talked about rollbacks, as advocates and as people concerned about the issue of housing and homelessness, it's really important that we speak to and hold on to that homelessness is a crisis, whether we're in COVID or whether we're outside of that situation. So on that note, we thought we would do around a half an hour Q&A to open up to the audience. So Paul, do you want to?
Yeah, so I think I'll stop sharing the screen. I think that's what I'm supposed to do, which I have done. And let's just open it up to discussion. Now, just quickly, whilst you're getting some questions together and points together, just go back to that call from ACOS, I think it was this morning actually, around increasing the stock of affordable housing and a stimulus package. For those who remember back in the global financial crisis days with Rudd and the significant homelessness response at that time, the Rudd government had that stimulus package in place. There were houses coming on stream very, very quickly, and there were programs in place that enabled a transition from largely rough sleeping, chronic rough sleeping, into housing. So one particular program that we did some research with, Liz Conroy and others, in Sydney, some of you would know the program, the Misha program, was one in which there was a transformation, a transition of people from chronic rough sleeping into those new homes. Not all new, but many of them were part of that stimulus package of extra spend on increasing the social housing stock. And close to 90% of those who got that permanent housing at that time, 3 years later, when we did the work on it, were still housed with a lot of tenancy support from Mission Australia workers. Shows what we can do, and that's exactly what we need to be thinking about now. We do have the opportunity right now, not only around the stimulus package in that social housing area, but it's likely that there will be other kind of housing that will be coming available at relatively cheap rates, if you like. So the opportunity is currently there. Okay, so let's open it up for discussion. One of the things that I was interested in comments from, I don't know whether Lee is still there, just going back to the response with the transition into motels and so on. And the impact that was a great work that's ongoing currently, and Australian Life Stand Homelessness and other groups are now moving around, working to the transition to permanent accommodation. But it's not necessarily an easy transition. So Lee, I think you made a comment in that context. Do you want to just say something there?
Sure. Thanks, Paul. Yeah, I've been working on a project around looking at the types of environment that people who have been moved into motel-style accommodation and what their experience is, and does that experience help enable them to move into successfully transition into longer-term accommodation. And whilst it has definitely been a really positive sign of getting people out of off the streets and into shelter, the challenge has been for a number of people that it actually is increasing isolation, that there's no green space, so there's no front yard where people can go out, and that being locked in a single room as opposed to having a number of rooms in a house, it's magnifying a lot of mental health and existing trauma, and the experience of isolation. The other challenge that I was feedback on around Sydney in particular is that there's still probably at least 100 or so more of really entrenched chronic rough sleepers that have kind of gone to ground and serious mental health challenges and other associated issues that makes that just not appropriate for being placed into accommodation without any type of regular and ongoing and intensive support that is around that area. And it's hard to find outreach to them at the moment as well, because they're moving up back alleyways and whatnot to avoid getting hassled by police and so forth.
Yeah, that was really the same response in terms of Lee, in terms of after Martin Place in New South Wales as well. One of the byproducts of actually housing people in temporary accommodation was that those who didn't want to be kind of bothered by police or bothered by people of the council were incredibly good at kind of cutting themselves off from other support by hiding in other locations. And I think to your broader point, it is really important that, again, I'm kind of, New South Wales is my context, but I know that there's been ongoing issues in terms of temporary accommodation around people that have experienced domestic and family violence, as you were saying, around trauma. I'm concerned, and we're hoping to do some work in this space as well, around what are the kind of trainings in place for hotel staff, what are supports, are the wraparounds, how are we actually considering trauma-informed care when we're actually providing these temporary accommodation? Because one of the things from mine that I've often had to work with housing authorities around has been the temporary accommodation, or whether they've offered kind of more permanent housing, is not understanding the sense of community and the sense of kind of actual safety that rough sleepers actually have. And so housing authorities often don't necessarily understand that, well, we've provided accommodation to someone, how come they're returning their key, or how come they're not living there? And I think in order to really authentically address homelessness and provide someone with a housing option that's safe and secure for them, we do need to consider that whole range and that whole spectrum of what a home looks like for someone.
We're looking at that, this short project on the other access and available accommodation other than hotels. For example, we're working with Uniting about their camping and convention centre accommodation that is going to be empty for now and a significant period of time. And we use that to create that village experience where you can have both practice social distancing, but also practice social connection at the same time, and as a way to, as opposed to the pure hotel version, which is just a good immediate spot, but doesn't actually create a pathway of a developmental pathway out of long-term homelessness.
Oh, completely. I'd actually love to speak to you further at some stage about that, Lee, because it sounds great.
Yeah, good. So, Lee, for those who don't know, and I hope you're still in the same position, because I'm going to be saying you're Wayside Chapel. Well, we're in Wayside Chapel when I knew you, yeah. So, so obviously, I don't know where you were working right now, Lee, but certainly when I was interacting with you a couple of years ago, you were in Wayside Chapel and knew absolutely what was happening there, just straight out. So it'd be good to hear from other states as well. Just a couple of things on the chat. So the program that I'm talking about, the MISHA, it was called the MISHA program, MISHA. And you'll see it on the Mission Australia website. You'll also see it on the CSI website if you dig deeply enough. And great, Erin, you've got the website address for that. And so when I was working with Liz Conroy and others in that, it was interesting to go into some of those those homes that were being provided under the stimulus package. Great places, by the way, great places. Not all of those who were part of Mission got into the new homes, but just showed what could be done. And that was around Parramatta and Sydney. Yeah, so it'd be good to hear just on that question of the transition into hotels, motels from any other state. So if anyone else wants to just let me know whether they've had good experiences in other states. I know with the Alliance to End Homelessness, and David Pearson's on the line too, and we're going to have another webinar tomorrow for those who are interested. The fact that we had in many places a really good record of people through what was called the by name list, and the Advanced to Zero program was very important in being able to prioritize that initial housing for those with significant health issues, but also being able to support people going through in terms of permanent accommodation. So right now, and I know Jerry Gannon, you were talking about, well, what's the next step? Well, the next step is that many of the homelessness services that are working around this do have very strong connections into permanent housing, and they are currently trying to transition people not back to the streets, obviously, but back into permanent accommodation. So if anyone from one of the other states other than New South Wales wants to talk about their particular experience, just jump up, let me know on chat, and I'll call you out. If you can just put your indication on for a chat or through various mechanisms, let me know.
I think Robin has one from Tassie.
Okay, Robin.
Hi, yes, I was just, we've just had an announcement from our Premier that they're rolling out the Safe Night Space pilot. And it sounds like it's kind of an interesting temporary accommodation model. It's actually just been a night space, and they're now embedding some support around it. And look, it's not my space, but I was just interested in any reflections on what we should look for in terms of, positives and as well.
Yeah, fantastic. There was also some questions around the support levels. So in most areas, support has been provided. It's not just a matter of a transition to a motel or to an isolation kind of area. Generally speaking, say I take the Victorian case, you might have launch housing, maybe doing the work around the housing, or Sacred Heart Mission might be coming in with some support. So generally speaking, the support has come in into that arrangement. I think the issue around support, particularly around mental health support and AOD support, is that whole question of not all services have been able to continue a face-to-face delivery for those outside of the motel structure, and there is that indication from various people, about the fact that they just can't get that face-to-face support that they absolutely need with their very significant mental health issues that they're facing. So that's a real concern. The other thing I was going to just check in, just to see whether there's anyone working in other spaces. So we mentioned family and domestic violence and youth homelessness. We haven't heard probably enough. I know the youth homelessness sector has probably been saying, there are some issues out there for us. And if there is anyone who is coming from the youth homelessness sector and is able to say something, that would be great. Obviously, beyond that response there, which I do regard the transition into transitional temporary accommodation, and then hopefully into permanent accommodation, which Jerry was saying, is potentially the most significant movement we've seen in Australia, but it very importantly rests on this incredible platform that was already there around ending homelessness around Australia. You know, the A to Z platforms, the by name lists, the data collections, all of that work that was done over the last decade has put many services around Australia into a strong position, and governments have also been very strong in this area as well. All right, so if anyone wants to say something about youth homelessness, just jump in, let me know.
No.
I think Liesl had one about older women.
Older women, yeah.
Yeah. Well, I live in social housing myself, but I also live across the road from a Quest apartment block that has recently housed a whole lot of homeless people. That has been a big trial and error thing, especially in our area where there are a lot of social housing buildings. So that interaction between the homeless people and the social housing tenants hasn't gone very smoothly. In social housing, there's a lot of issues in it. I just don't think they really look at the mix of people they place in there. It's not a good thing to have women and children in with people with severe mental health issues or addiction issues. It's just creates more trauma. And I've seen that in the motel across the road. They've got women and children in there, and then they've got guys that just want to drink and have a fight. We've had police, we've had, people being arrested while the homelessness services are going there, but it's been quite an interesting thing to observe. But I currently am in a working party. My main focus is older women and the risk of homelessness and the rising amount of older women in homelessness. And it's I would love to speak to you later, Chris and Lee, because I'm working with Q Shelter, but we're finding that a very difficult issue because often we don't see it. Older women don't want to talk about it. And where we can house them is completely different. Not everyone wants to be in a unit. They need access. They're older women. They can't all walk upstairs. We can't put them in social housing with certain people because they have experienced a lot of trauma. Many of them have experienced domestic violence. That whole issue surrounding women, I find, is quite an interesting and difficult one to solve, whether they be older or younger with children. There needs to be, especially people leaving, I think, from domestic violence relationships, some sort of transitional housing, much like Vincent Care is doing in Victoria. And we are working on developing too for older women in particular, but older people in Queensland, I'm in Queensland, a one-stop shop. So they have easier access and a platform to services where people with lived experience will actually be trained to help the other people, which I think is an interesting model.
Yeah.
Wondering how many of them are still out there and in these terrible situations because they're virtually hidden.
Yeah, it's a good point.
Yeah, it's been a very significant factor if you have a look at the census data over recent times. And the responses need to be, so I think that the one thing that comes out of what you just said was just how important the response needs to be differentiated according to the needs of different people. And it's got to be appropriate. The response has to be appropriate. And just because a particular hotel or motel has come available doesn't mean that that's going to be appropriate for everyone to move into. Other issues that we've seen are around the fact that there has been a great community response, but that response may not have significant levels of funding and financial support behind it. And so you've got these high expectations, and all of a sudden that money stops and you move into something else. And so we've seen a couple of experiences like that as well. This requires a really significant amount of government funding and support, and every state and territory does actually have a package in place right now It's just that it's somewhat bigger in some states than others, and it's more continuing over time.
Paul, sorry, can I jump in, Paul?
Yeah.
As we know, there are a number of agencies all over the country doing some terrific work in helping in this issue. And I'm wondering, is there sufficient coordination between all of these agencies so that there is a concerted outcome, if you like? The other thing that always has concerned me is the fact that we tend to be addressing the actual accommodation aspect of homelessness, and are we neglecting the actual needs of the people who are homeless? Why are they homeless? What is it that we can do to alleviate that? Because if we fix that, we can then fix the issue of homelessness in part. For instance, many middle-aged men who, for instance, go through a breakup of their relationship, that's often followed by job loss, and then they fall into this cycle of couch surfing, and eventually they're homeless. I think one of the reasons that we don't talk enough about is the reasons why these individuals are homeless. What was the problem that caused them to be homeless, and how can we fix that? If we fix that, we're on the way to fixing the homeless issue.
I think one of the difficult issues, and we've found that with women, is it's very hard to get someone a job when they're homeless. Like head of MICA up here has said that the way to fix this problem, and she will stick to this, the only way is to find people homes. Once they're housed, we can provide them with services, we can connect them to job networks, we can have people come into their home to help them with trauma or anything. But when they're homeless and they have no fixed address, it's very hard for them to access services, or for people to go see them and provide access to services, or to find a job. What are you going to put? This is my home address. This is my phone number. If you don't have those things, it's difficult to find a job. So having stable accommodation is really the basis for all those other services to come into play. I think that's,
Yeah, that's absolutely right. You try and fill in the form when you don't have a fixed address. All the different forms you have to fill in, I can tell you, it is just unbelievably difficult. And that's just filling in the forms. That's not the stigma kind of issue. Just going back to Jerry, yes, everyone does have this different pathway, different journey, and we need to navigate through that different journey. In terms of coordinated responses, what we're seeing is a really good kind of level of interaction around particular groups. So, for example, those that have been involved in the Advanced to Zero programs around Australia are interacting very strongly with each other and with government. So we've seen some of that too. Now, there are some other questions out there which I don't currently see. So Rhonda, can you pick one or two of those questions or people that we can interact with right now? Because I'm not... Yeah.
Sure. There's a number of questions, so if you just scroll up, but I might just read one out. We've talked about the housing first approach. I was curious to hear your perspectives on what's required on the longer pathway to help homeless individuals reintegrate back into society through employment. How do you see that pathway to employment in this COVID environment?
Yeah, it's a very, very important question. So the housing first agenda is something that I support very strongly. It's got to be housing first plus, if you like, which is what I refer to. So let me give an illustration. When we did the work using what's called this VI-SPDAT data, vulnerability index data around Australia, where we looked at over 8,000 people who answered the question, what do I need to be safe and well? What was so strong about that was how critical housing was, and how critical getting into housing and then solving other problems was. Just to get back to the previous point that was made, but just the broad range of issues. So what do I need to be safe and well? I need to have social connections. I need to be with someone. I need employment. I need to be away from violence. So when we're talking about a response going from here, it is actually not just about housing. So we've got to be very careful about the housing first message that it doesn't just come as this very simple, solution, because everyone talks about housing and something else, and it may be something else beyond that and something else. And employment is really significant, much more than people recognize, because without that employment, people are in poverty. So yeah, this has to be a very holistic response, not just about getting people housed and thinking that's going to be the end of the story. It's not. If you just get people housed and that's it, many people will have an increase in loneliness, et cetera, et cetera. So it's got to be a very holistic response. Let's go to someone with who's online with another question, who might want to give that question or comment to everyone online right now.
We've got another, just while people are typing potentially, I've got another comment / question from Dan. And also thanks to Jessica for that previous question. So from Dan, is co-design being considered as an approach here to ensure that what is implemented hits the mark? Seems like lots of reacting to the scenario rather than consideration of needs.
Yeah, it's an interesting question. I'm probably speaking for the New South Wales context, that in terms of co-design, there's a number of groups out there with the lived experience of homelessness who do provide advice to the New South Wales government on housing strategies, and they're a fantastic resource, and at times a quite importantly critical resource of what is going on. To be honest, I'm not aware. I think obviously the peaks and a lot of the larger services have been involved from an advocacy point of view, and I'm getting mixed kind of feedback on terms of how far their voice is penetrating, but I think a lot of it has had to be a rapid response. But I think as we kind of roll out and look at addressing things on a more permanent basis, that co-design is incredibly important. Like, I know that it definitely informs the work that Paul does and the work that we do at CSI, that co-design is not only incredibly important to actually producing outcomes that are effective and targeted at groups, but it's also like a fundamental human right. So a part answer to your question is, like, I'm not sure on what level that's happening, but definitely as housing strategies develop, that they need to occur. That needs to occur.
Yeah, it's a very interesting area. So those in Western Australia will know the work that was done with the West Australian Alliance to End Homelessness, and YACWA, which is Youth Affairs Council, and there was a group who led a response to that, a youth lived experience group, and fortunately they changed their acronym to YHAC. Previously it was Hayek, who happens to be a particular kind of economist who always resonated in my mind whenever I heard Hayek. But YHAC was a group of young people who had direct experience of homelessness, currently homeless or previously homeless, and they wrote a story. They wrote how we need to work around youth homelessness and to end youth homelessness. And that group is still going and is providing that lived experience, direct voice into how we do this properly. And I totally agree with the speaker that that lived experience voice is so critical to an understanding of where we need to go. Okay, so
I know that in our working parties in Queensland, we have a lot of actual women with lived experience or at risk of homelessness in those working groups. So it's not just from the top down. We are talking about co-designing with these women, and there's a lot of conversation about the different types of housing that they need and how not just build one model, but different models, whether it be shared housing, whether they have some super, some of them, and they want to buy a house with other people, whether they can live in an apartment, whether they, so some people want to have more like commune type setups, so they have a vegetable garden and can talk to people. And so we are really involving older women and their voices in that process rather than this is what you need. But I think we're going to see a lot of trauma. I was looking at some of the questions when they start rolling back, like, where do the homeless people now go from these motels? And also once they take back that extra $550 a fortnight that people are getting, that trauma will increase homelessness and the trauma in the sector overall. I think it's going to be quite a terrible thing to see in some cases.
Yeah, so that's the question Tanya's put in one context around those who are currently receiving that temporary accommodation. But as I said, there are there's work that's being done right across Australia around that transition into permanent accommodation. It is occurring. For example, I don't know whether anyone is here from Adelaide, but they have had a really significant fast transition into temporary accommodation, but they're now also moving straight into permanent accommodation. So that's working really well. I did like the comment from Catherine Robinson.
From Adelaide. If you're
Sorry?
I'm here from Adelaide, or in South Australia, and interestingly, last night our Premier committed to making sure that none of the people who are in hotel rooms will end up back out on the street. So we'll be holding into that.
That'd be interesting.
Fantastic. And there are 250 plus people who moved into temporary accommodation. And if that commitment is maintained right across Australia, then we've got an amazing outcome. I know it's not always been like that in every place across Australia, but very important. Catherine Robinson. Catherine, I like the point that you make. Perhaps you can just go on online now and make that to everyone about it's not just about housing, but about home.
Yeah, I was just responding to the comments about making sure that we're thinking holistically about responses, whether it's to rough sleeping or other forms of homelessness. And I just really support that. It's wonderful that there's such a focus on accommodation at the moment. Obviously, that's a critical part of the public health response. But as you were saying earlier, Paul, the public health emergency for people experiencing homelessness has been ongoing before COVID and will remain as COVID eases. So it's clear that temporary accommodation for the public health emergency that people experiencing homelessness experience is only potentially going to exacerbate or prolong that emergency. So again, we just need to be conceptualising something more stronger, which is this idea of home, which is where we experience both shelter and care, support, love. That's the thing that we need to be fighting for.
Completely agree. And seeing your face, Catherine's also kind of reminded me as well, as much as we're talking around housing first responses to rough sleepers, we need to be thinking, which kind of Paul has said, the whole range of cohorts beyond rough sleeping, that rough sleeping is such a small percentage of those that are experiencing homelessness, particularly experiencing homelessness around children, around young people, maybe unaccompanied children in the homelessness system as well. And as we kind of pivot out of the COVID crisis, we need to make sure that those responses are there. And I think it's incredibly important, Catherine, what you're saying around pivoting to seeing not as a house option, but a home option. But within that, still saying that what we need is the significant investment in social and affordable homes, and that a massive cohort of people are missing out simply because the public responses, health responses, had to be on rough sleepers at this stage. But we can't forget the other cohorts that are kind of making up that group of people experiencing homelessness.
And look, this is where I like to think about the need for an infrastructure of care that incorporates, long-term affordable social housing, but also a range of kind of allied supports that make being in that housing possible for those who may have a range of other issues. So I guess we just got to make sure we're greedy in what we advocate for.
Exactly. That's a very good way to end. I think that's very good, to go for, the full whatever. and not just a small response. So that's a good point to end. As I said, you can find a recording of this on the CSI website soon. You can see our CSI response online as well. If you want to continue on the webinars, CSI Impact 2020 webinars, go to the CSI website. If you want to continue on a discussion tomorrow on homelessness, there is another webinar which is being run out of the Australian Alliance to End Homelessness, so check that one out. And there'll be further news about the responses there across Australia. So David Pearson's just put up the address for that. Thanks everyone for a great discussion. I very much appreciate everyone coming on stream. Seeing some old faces and, well, not old, very young faces that from around Australia that I've connected to over time. And so it's been a wonderful kind of chat. So thanks everyone, and see you again some other time. Thank you.
Thanks everyone.